With the rising number of COVID-19 cases globally, let's imagine what it's like to be admitted or hospitalized with a severe COVID-19 infection. Let's go! Hi, my name is John Mendoza and I'm a critical care healthcare provider. If you're new to this channel is mainly about health and medical sciences, mathematics, and examination and career tips as well. Tonight we're having our healthcare series and we're going to talk about what it's like to be admitted when you've got a severe COVID-19 infection. It's inspired by respiratory therapist Karen Gallardo's blog, What the 7 Stages of Severe COVID-19 Look Like. This video aims to help you visualize the journey of a very sick COVID-19 patient, and sadly it's not a very pleasant one. So let's start. So you've tested positive for COVID-19 and you're staying at home, and then suddenly you've become more breathless. Aside from the cough and the fever, you decided to ring the ambulance to help you go to the hospital or the A&E or the emergency department. So you're now in the emergency department, very breathless, and we take your vital signs or observations, blood pressure, temperature, pulse rate or heart rate, and respirations. We also give you medications such as steroids, antivirals, monoclonal antibodies, and anticoagulants or blood thinners. Then we check your blood oxygen. If it's better, then good news, you go home. Otherwise, you stay in the hospital and we send you to the ward, the respiratory ward. So you are being looked after on the respiratory ward and you're on a tiny bit of oxygen, maybe 1 to 4 liters via nasal cannula, and then breathing just becomes harder for you. Even just when you're doing your activities of daily living, eating, drinking, washing, or even talking. Your oxygen requirements increase from 4 to 15 to 60 liters that we have to contact the outreach or the intensive care team so they can review you or assess the need for you to be transferred to the intensive care unit. Now you're in ICU with 60 liters oxygen but still being breathless. So one of our doctor colleagues will insert a line, what you call an arterial line to your artery, so we can take blood samples without pricking you too much. This is to check your blood oxygen and monitor your blood pressure as well. However, your blood oxygen is still low that we have to put a new oxygen delivery device. It's a breathing mask going to cover your nose and mouth. This is to give more pressure, more oxygen into your lungs that a simple nasal cannula cannot do. Unfortunately, you got to keep this mask on for around 24 hours except for breaks. For instance, you have to eat lunch or dinner. However, because you're still dropping your oxygen levels, then we have to keep that mask on and you won't be allowed to eat or drink. But don't worry, at this point, we're considering on putting a nasogastric tube. It's a feeding tube that we insert through your nose into your stomach so we can give you artificial feeding and optimize or maintain your nutrition. As the days pass by, you're not improving. Your oxygen levels still the same or worsen, and also you're starting to get tired. Now we're going to talk to you and to your next of kin about the next plan. It involves putting a breathing tube into your throat. It's called an endotracheal tube. It helps expand your lungs and improve your oxygenation. It's a tough decision because some patients do not want to be intubated, but more often than not, this helps you fight COVID-19 and improve. Now you've got the breathing tube, which is attached to the breathing machine or the ventilator, which does the breathing for you. But we'll have to help you suction the saliva and the phlegm to keep your airway clear. Also, the physiotherapist or the physio will come in and listen to your chest and treat your chest as well. Now you're less mobile, so we're gonna help you move. We're gonna roll you and we're gonna reposition you with some pillows to ensure that your skin remains intact. Also, with the feeding tube in, the dietitian will review your nutritional requirements and prescribe the best feeding regimen for you. While the feed is artificial, it's our only way to optimize your nutrition. Also, you've got a catheter, which is a rubber tube inserted into your bladder through your urinary passage, and this allows us to monitor your kidney function, making sure they're all right, and to monitor the fluid balance as well, which is the amount of fluid going into your body and the amount of fluid coming out from your body. On top of this, you're still being treated with antivirals, antibiotics, and steroids, and every day we're sending blood samples to ensure your inflammatory markers are calming down. Sometimes your oxygen levels are just too low, so we decide to put you on your tummy. It's a procedure we call proning. This is to oxygenate your lungs and body. Your COVID-19 status and low oxygen levels may lead to organ failure such as the liver and the kidneys. Because you pass only little amount of urine or no urine output at all, it may signal that your kidneys have started failing, possibly because of the medications that you've been having. So we're gonna put another catheter into your neck or into your groin to start dialysis to help the kidneys cleanse the body by getting rid of the waste products. Aside from the kidney failure, your blood pressure may also drop because of the infection or the sedation, so we're gonna put you on some medications called INOTROPES. These medications improve or increase the blood pressure. Also, we might give you some fluids as well. In some circumstances, the heart monitor shows a funny rhythm and it may indicate that your heart stopped beating. So we'll ring the emergency bell and notify the resuscitation team and start compressions or CPR. At this point, we'll contact your next of kin and tell them what's happened, and they might make a tough decision. Due to your very poorly state, we'll contact your next of kin and inform them that you might not survive this admission. They might withdraw the treatment, which is very painful, not only to them, but also to us. Although the hospital is not allowing visitors at the moment because of the pandemic, we'll let your family in because you're now in the last days, last hours of life. We will speak to them and this may be the last time they're gonna see you. We will give you pain relief and then we're going to take your breathing tube out. With the decline in your oxygenation, you're gonna change your color quickly. You'll become pale. We'll hold your hand as you gasp for air, but after a few minutes, you'll stop breathing. So guys, it's very sad, but that's the worst thing that can happen to a person with a severe case of COVID-19. If you like more videos on health and medical sciences, mathematics, examination tips, and career tips, consider subscribing to this channel and hit the notification bell for more updates. I'll see you later in our next vlog. Thank you very much for watching and stay safe.